Hey gang, Brian RN here. Today we're going to be going over vital signs. So thank you so much for watching me. Vital signs are going to be taken on every patient through admission. They're going to be taken whatever that facility policy is, whether it's every 4 hours, every 8 hours, or whatever that be. It is going to be taken with any change in patient status, especially if they become unconscious or confused or anything like that. It's also going to be taken before certain surgical procedures and after as well, and oftentimes it's trended after that, and it may also be taken before you give certain medications, especially ones that are going to affect cardiovascular or respiratory status. So anyway, you're going to be taking these all the time, so I'm going to help you get really good at it. We're going to cover what they are, how to take them. We're going to give a live demo. We're going to go over the parameters, as well as what makes some of them go up, some of them go down. But yeah, so these vital signs are going to include pulse, they're going to include pain, they're going to include temperature, respirations, blood pressure, pulse ox. You don't need to do all of these every single time. Some of them will just be specific to that situation and what you're caring about at the time. The first thing you're going to want to do whenever you start is going to be to gather your supplies. You don't want to go into the room and not be prepared. So anyway, you're obviously going to need your gloves. Nursing school's taught me one thing. These are a saving grace. But in addition to that, whatever the protective equipment is needed for that room. So if maybe they have C. diff or they're on contact precautions, you need a gown or some kind of droplet, you might need a mask, something like that. You're also going to need your documentation, whether that be a computer nowadays, or maybe you're going a little old school with some kind of a documentation sheet. You're going to need a stethoscope, you're going to need a watch, you're going to need a sphygmomanometer, pulse ox, we'll go over that, and you're also going to need a thermometer. Don't have one. I just moved out, so I don't have one right now, but I'll go over how it's used and everything and what the routes are. And then lastly, you're going to need some kind of a disinfecting wipe. Whatever you bring into the room, you're going to have to bring out, and you're going to want to wipe that down to help prevent the spread of infection and things like that. Alright gang, so at this point I've looked up my patient a little bit, tried to figure out what to expect when I was going in, or maybe got reports. I performed hand hygiene, I donned the proper protective equipment, and then provided for privacy. So now I'm in the patient's room. First thing you want to do is obviously introduce yourself. So, hi, my name's Brandon. I'm going to be your nurse. I just came in to check your vital signs. Is that okay?
Yep.
Oh, perfect. Alrighty. After you've introduced yourself and explained the procedure, then you want to ask for 2 identifiers to make sure that you are documenting on the right person. Can you tell me your name and date of birth?
Alyssa, 8/17/1997.
And your last name?
Dicker.
Oh, perfect. And I checked with my chart and I can see that all matches up. So at this point, the first vital sign that I like to assess is pain. I do this for a few reasons. One, it's easy and it's a nice way to kind of ease into, before you automatically lay hands on the patient. But also, pain can help to change some of the other vital signs. If she was having excruciating pain, then that would, maybe explain why her pulse is high, or her heart rates, or her respirations are high, or things like that. So, are you having any pain, Alyssa?
Just normal ab pain. I did a workout yesterday, so nothing out of the ordinary.
Okay. Now that pain, would you be able to rate that on a scale for me? We do between 0 and 10. 0 is no pain at all, and 10 is the worst pain you've ever had.
Like a 4.
Like a 4?
Yeah.
Okay. Are you able to describe that pain for me?
Just normal muscle soreness.
Okay, perfect. So you always want to rate pain in terms of where it is. You want to rate it in a scale of 0 to 10. And you also want to have them describe it for you. So those are the most important things when you're looking at pain. And then you document it accordingly. This is important to take it at the patient's word. Sometimes you might hear it a lot where people have a hard time telling how much pain there is. It's subjective to the patient. So you really have to document it as it is and then treat it accordingly based on that. After pain, the next vital sign that I like to check is temperature. So with this, there are many ways of taking it. You can take it orally, you can take it rectally. This is most common in newborns, and also continuous monitoring for the critical ill. You can take it through the tympanic membrane, which is that membrane in the ear. You can take it temporally, which is the way that I'm going to show it. That's the most common in the hospital. And you can also take it axillary, which is just the armpit. So through the temporal method, I don't have a temporal thermometer, so I'm going to show you with my handy dandy remote. But it's the same process either way. So it's relatively easy, and it's not very intrusive to the patient. All you have to do is press the button, hold it up to the patient's head, and start on one corner of the forehead, move all the way across while holding the button to the other corner, and then press it behind the ear as well. So then you look at the number. The normal ranges for this is 35.8 to 37.3 Celsius, or that is 96.4 to 99.1 Fahrenheit. Now, this can vary, and it changes a lot. Most commonly, if it's high, that shows illness, maybe a fever, inflammation, things like that. But also it could change because of age, exercise, stress. Could change due to the temperature around, especially with this one. You have to watch that. Medications that you give, it might be low or within normal range when she actually had a fever if you just gave her Tylenol. And also it can change depending on where the temperature was taken. So as I mentioned, the temporal method is strongly affected by the temperature around, but generally it's going to be a little bit lower. So orally is the kind of baseline that we set it off of. You can see that the temporal and the axillary, they're considered to be surface temperatures. So they're generally about 1 degree lower than the oral method, and if you would go internal, then that would be considered rectal, or it would be considered tympanic membrane, and both of those are about 1 degree higher than the oral route. Okay, what goes next? Next thing we're going to want to check is the pulse. Now this is the force that is pumped from your heart through all of your body, and it can be heard and it can be felt. We are specifically going to cover how it is felt, and the most popular way it is felt is through the radial route. So the radial route is on the forearm. It is on the thumb side of the forearm, just on the wrist. So you can feel it right here. You want to make sure whenever you're measuring it with your 2 to 3 fingers. You don't want to feel it with your thumb. The reason is that you have a pulse in your thumb, so you would be able to feel your own pulse and be hard to tell between what's hers and what's mine. So anyway, you can feel it right there. The terminology with this is going to be tachycardia, which would be fast heartbeat. That is rated above 100, or bradycardia, which is a slow heart rate. That's below 60. So the normal range is going to be from 60 to 100. The other one is dysrhythmia. Now this one is talking about any irregularity. So it does include tachycardia and bradycardia, but also includes any irregular pulse or anything like that. Now, whenever you are feeling pulse, you want to make sure that you're feeling for at least a full 30 seconds. So I'll feel for a full 30 seconds. This is where it's important to have your watch. You feel for a full 30 seconds. If it's a regular rhythm, all you have to do is wait for that 30 seconds and then multiply by 2. So feel for that. And now let's say that she had a irregular rhythm. If that's the case, then I'm not going to multiply it by 2. What I'm going to do is I'm actually going to wait for a full minute. And I'm going to count out every single pulse for that full minute, and then I can be a little bit more accurate. The next thing that you're going to want to cover is respirations. Now, this is kind of a tricky one where you have to do. Respirations are the air going in, inspiration, or the air going out, expiration of your lungs. Now with this, it is both autonomic, meaning you do it yourself without even thinking about it, but it can also be voluntary. So you can control it, you can hold your breath if you want to. And people tend to do that whenever you tell them that you're going to count their respirations. So this is something where you have to kind of do it a little bit secretively. So with this, what you want to do is you want to feel for their pulse. If it's a regular pulse, you count it for 30 seconds. You wait the 30 seconds. And then after the 30 seconds is up, you stay there, you continue to look at your watch, but instead of paying attention to the pulse, what you're going to be doing is looking at the chest or the stomach for rising and falling. So you do that for another 30 seconds. If it's regular, if it's an irregular respirations, then it's going to be for a full minute. The normal rate for respirations is 12 to 20, and some of the terms there are, I can't ever pronounce these right, bradypnea, which is less than 10, or greater than 20, which is tachypnea. It is eupnea that is the normal 12 to 20 range. Now another term is dyspnea. Now that is a shortness of breath. There is orthopnea, which is a shortness of breath when you're laying flat. And there is apnea, which is not breathing at all. Now, the next set of vitals that we're going to be collecting is blood pressure. Now, this can be done automatically. All it is a cuff like this hooked up to a machine. It inflates itself and it measures. Super easy to do, and you put it on the arm the same way that I'm going to show you. It can also be taken manually, as I'm going to show you here in a second, or it can be taken through a continuous A-line, and we can go over that in another video. But what it's measuring is the force that the heart places on the arteries whenever it contracts, which is the top number called systolic, or whenever it's relaxed, which is the lower number called diastolic. The highest number that it can be, or the normal range that is expected, is less than 120 systolically or 80 diastolically. So whenever you set this up, there is a little reading on here. This reading is going to be the numbers that you're going to pay attention to. So you're going to listen. I'll show you as I do it in person, but you're going to inflate it, and then you're going to listen, and you're going to start to hear a thumping sound, and that is your systolic number. And then when you stop hearing the thumping sound, that is your diastolic number. Whenever you are setting up, you want to make sure you're paying attention to whether you're putting it on the left arm or the right arm, and the important part of that is going to be in whether this is able to be seen or not, and this rotates. So I'm going to put it on her left arm. I want to first feel for the brachial artery. Now that is going to be on the not thumb side, the pinky side. And you are going to align this line with her brachial artery. So I feel for the brachial artery. I put that arrow right there where I felt it. And then I want to close over the cuff. This line is then supposed to fall within this range. And you can see that this is a properly sized cuff. If our arm were smaller, I would need a smaller cuff. If it were bigger, I would need a bigger cuff. And then with that, I'm able to see this dial. As I'm doing it. So I'm going to put my stethoscope right where I see her brachial, right where I could feel her brachial artery, right there. And I'm going to inflate the cuff and listen for that systolic and diastolic number. Now, before I do that, what I want to do is I want to get a range of where I'm going to be going with it. Now, if this is a patient that you've had for a while or has a record, and you can see what her numbers have been, you can avoid this step. But what this is going to do is preventing from overinflating the cuff. So I haven't seen her before. She is coming into the doctor's office and doesn't have a record with us, so I don't know where her blood pressure has been. So what I'm going to do is I feel for that brachial artery. I can feel it. I'm going to inflate this cuff. You don't want to press too hard on the brachial artery because you can occlude it. But I'm going to feel it. I'm going to inflate this cuff until I can't feel it anymore. So it was about 110 that I stopped feeling it. At 110, I need to go 30 higher than 110. So that's going to make it so I can just get to the point where I am able to hear that systolic pressure, but I'm not overinflating too much. So I'm going to now listen. There are two sides to the stethoscope. There is the diaphragm, which is the bigger side, and there is the bell, which is the smaller side. They both listen. One is just better at listening. The bell is better at listening to smaller areas, and the diaphragm is better at listening to bigger areas. Whenever I was in pediatrics, they didn't have the pediatric stethoscopes for us, so I would use the bell for the pediatrics. I prefer the diaphragm just so I don't accidentally forget about switching it back and forth, and it works well for me either side. So I'm going to use the diaphragm to listen, and like I said, just put it right over where I felt that brachial artery. So I stopped feeling her pulse at 110, so I'm going to go up to 140, 30 higher. Now, I started hearing the thumping sound at 110, and I stopped hearing the thumping sound at 68. So, her systolic number is 110, and her diastolic number is 68, which is within our normal limits of less than 120 and less than 80, systolically, diastolically. This can change for a lot of reasons. We're not going to go over every single reason. We can cover that in another video. But it could be elevated if she was having pain, things like that. So you just want to pay attention to try and rule out what could be causing what. The last vital sign that you want to check is pulse ox. Now, I happen to have a portable pulse ox, but they also have ones that are hooked up to the full monitor. Either way, it's only something that can be done through an electronic device. So I will show you this. You can see on here, there is a SpO2 button, or SpO2 number, and there is also a heart rate number. So if you're in a rush, or it's just standard monitoring, there's no reason to be concerned. You can get your heart rate off of here as well. That's not necessarily recommended, just because these do have errors. On the monitor, sometimes they do have what we call a waveform, or a pleth. What that is it just looks like a little, almost like a heart rate, and you should be getting a clear waveform from that. If you're not, then it might not be reading well, and you would need to troubleshoot why. These are notorious for not acting quite right, so try not to freak out if it's giving you some crazy numbers. Try to figure out the equipment, look at the patient first, and see if maybe there could be an issue with that somewhere. These only really work if your finger is warm, if it is getting good blood flow, if it's clean. Sometimes painted fingers can mess it up. And like I said, when in doubt, just fall back on that waveform to try and get an idea, and the patient presentation to get an idea of what you're encountering. So all you have to do, it's nice and easy, is just put it on her finger, and you can see that it takes a second, but now we have 99% oxygen and a pulse of 73. And that gets updated. You can see with the blinking that it is having, it's able to get, that every single one of those blinks is with her heart rate, to show that it's working right. So anyway, it's nice and easy. All right, so there you have it. After you're done, you want to make sure you document everything, follow that format that we covered. You want to take off your gloves, perform hand hygiene, check about anything else, and then you also want to wipe down all of your equipment just to make sure that you're not passing infection. Thank you so much. If you followed me till the end, please like, subscribe, and comment any of your thoughts. If there's anything that you think that I could improve on or change, please feel free to comment and tell me what you think. Thank you. Bye.